Hi, today I'd like to talk a little bit about infertility and what are its symptoms. So infertility is a very common condition that a lot of couples face, especially nowadays where the birth rate is pretty low in Singapore and in a lot of first world countries. So infertility is not an independent disease. It is actually caused by up to 150 organic diseases of the reproductive system and even the hormonal system, the nervous system. All of these play a significant role in causing infertility. Infertility means that you are unable to get pregnant even though you are engaging in unprotected intercourse for a long period of time. But it is a big difference from being sterile. Infertile means either the egg and the fetus are unable to meet and something is causing obstruction, but sterility means that you are unable to produce gametes, which means you are not producing egg cells or you're not producing good quality sperms. And these two conditions are different, it needs to be separate. So infertility can be treated as long as the root cause has been diagnosed. So there are several conditions that can lead to infertility. For example, I will mention a few. If you have adenomyosis or endometriosis, it can cause obstruction for fertilization. So some of the symptoms that show up for this condition is that you have a very painful menses, and all of these things you need to take notes so you can help the diagnosis process and then get you treated. Another common cause is PCOS. Yes, PCOS not only can cause recurrent miscarriage, it can also cause infertility if it is a much more severe condition. And PCOS, the symptoms are much more obvious, so it's very easy to diagnose. Symptoms include body hair, acne on the face and the body, obesity, and then irregular periods, menses. So all of these symptoms and whatever you experience will help in the diagnosis process, because infertility causes are not singular. Usually there are 2 to 3 organic diseases that are causing the infertility. So it will help that if you can keep track of what you're experiencing and help your doctor quickly diagnose you, because infertility can be treated as long as the root causes are found, and then you go for the effective treatment. And once you go for treatment and once you are properly healed after surgery, pregnancy will not be an issue, I guarantee. So another thing about common misconception about infertility is that IVF is a very useful technique for infertility. So, and it's usually the most effective and the most least time consuming. So I'd like to correct this wrong form of thinking. IVF is only suited for infertility caused by fallopian tube issues. So if you have any obstruction, so fallopian tube issues, which means you have obstructions, damages or blockage of the fallopian tube, preventing the egg cell and the sperm cell to meet. So infertility can help in this way and can be very effective. Success rates are very high. But infertility, fallopian tube disorder is only one among 150 causes. Unless your infertility is properly diagnosed and it is found to be caused by fallopian tube issues, then IVF will be very effective for you, and I highly recommend that you go for it. Otherwise, if you go for IVF and it's not your infertility is not caused by fallopian tube disorders, not only are you going to waste a lot of time, you're going to waste a huge amount of money, because IVF is very expensive, and also it will cause a significant degree of damage to your ovaries. So I hope this video can give you a sense of understanding about infertility and the difference between infertility and sterility, what are some of the symptoms, how many causes they are, and what IVF can treat and cannot treat. Thank you.